Good evening, America. This is Q News Tonight, the world's first live daily gay evening news show, and it's 7 p.m. Thursday, March 12, 2020. Today, it officially begins. Coronavirus infects the LGBT community. We began last night with a part one telling you of all of the significant effects going on. Tonight, we're going to give you part two. But the issues of coronavirus have definitely hit America. Last night, we provided you all the latest information on how to keep safe with the rapidly evolving coronavirus pandemic. We reported on HIV-related risk, if you use masks, how and when to wash your hands, how to disinfect surfaces, and much more. Tonight, we are going to provide comprehensive reporting as to coronavirus infecting the LGBTQ+ community, part two. Tonight, we will focus on risk of virus on your clothes and how to do laundry correctly, recommendations for safety at work, what's next for our gay bars, events, and nightlife. We are going to report on the safety of eating out, recommendations on gay travel, how to shop safely at a supermarket, and advice on the gym. We're going to have myth busters on fact versus fiction, because there is amazing rumors out there, and advice on where you should be getting your coronavirus information after tonight. We're even going to report on coronavirus as it relates to Tinder, Grindr, bathhouses, and issues related to sex. But this time, safe sex means an entirely new thing. And most importantly of all, tonight, we discuss how long is this going to last. So this is Coronavirus Infects the LGBTQ+ Community, a Q News Tonight special survival report. Now, we begin our reporting tonight by showing you the significance of this event. And we have a slide here that we want to show you about the reporting in terms of the number of people that are being infected and the potential death rate risk by each of these groups. Covid-19 has a significantly higher propensity of death compared to the common flu. And we show you here 16 times in upper age group categories. Also, in terms of impact, we want to report on something that the Seattle King County mayor has said approximately 52 minutes ago. Mayor Dinkin, the mayor of Seattle King County, came on MSNBC at 6:07 today and basically gave a cry for help, saying that the estimated infection rate is dramatically higher in Seattle King County. Thousands of people are likely already infected, but they cannot verify it because of the lack of testing access that they have in Seattle King County. The mayor of Seattle, which is probably emblematic of every local community in America, says that if something dramatic is not done almost immediately, within the next 3 to 4 weeks, there will likely be, according to their health department recommendation information, more than 25,000 infections in Seattle King County, and more than 400 people are going to die, reported just 53 minutes ago. Q News Tonight is reporting tonight at the top of our broadcast that President Trump and Vice President Pence have been exposed to the coronavirus. We're showing you a slide here over the weekend, at the end of last week and over the weekend, of the communications director that was at Mar-a-Lago in Palm Beach. The Brazilian president's communication director had a meeting with the president and the vice president and senior aides. You see him here in this picture. He shared this Instagram picture saying, "Make Brazil great again." Later, the official tested positive for coronavirus. The White House has advised that neither President Trump nor Vice President Pence have any plans to be tested. Trump is 73 years old and Pence is 60 years old, and both are in the highest risk factors for morbidity for coronavirus. Both have recommended yesterday to the American public that senior citizens take extreme caution, seek medical attention, and isolate themselves during exposure risk. neither the president or the vice president have demonstrated to the American people that they can follow even the most basic of scientific advice, much less their own. So good evening again, America. It's 7 p.m. Thursday, March 12th, 2020. It's time to queer up the news. We are literally out of the closet and into the headlines. So many of your major stories tonight, next on Q News Tonight.
Tonight on the world's first live daily queer evening news show.
Tonight's news about the gay community and the news from an LGBTQ perspective. Are our gay stories important to you? In headlines, politics, entertainment, gay culture, travel, religion, and more. Reported by respected anchors.
Out of the closet and into the headlines on Q News Tonight.
Well, again, welcome to Q News Tonight, a very important special tonight on coronavirus infecting the LGBT community and what we should do next. Tonight, we bring you the news of and a perspective from the LGBT community. I'm your anchor, Al Ferguson, and these are my co-anchors, Aaron Darr and Napoleon Plays. So let's cue up the news. We have breaking Q News tonight, of course, the number one story on the entire planet, and that is about coronavirus. First, we are going to bullet point the big news points today related to coronavirus, which is the extent of the amount of information we can give it to you. First, we report on mass event closures all over America. Just today, the MLB, Major League Baseball, has announced the cancellation of spring training and a postponement of the 2020 baseball season. NBA and NHL have suspended completely their seasons for 2020 so far, and the NCAA has announced the cancellation of the different conference tournaments, and March Madness has been canceled, the March to the National Championship. It was announced today in New York by the Broadway Equity Association that all Broadway shows in New York are canceled for more than a month. And heartbreak for us here in Florida, Disney has announced that Disneyland in California is closed at least for a month. They have not announced for the Florida parks, but surely that is coming next.
Yes, and of course coronavirus is not only impacting just travel and other mass event closures, it's also affecting the economy, of course, because it's a domino effect. The global stocks are continuing to plummet. Just today, the Dow is down now 2,300 points, and this is some of the worst 10 days in history.
We, of course, see an effect on politics as well from coronavirus. On Sunday, the Democratic debate has been moved to D.C. From the CNN studios. The Canadian Prime Minister Trudeau has put himself in self-quarantine with his wife, who is ill, without any statement as to why she is ill. And, of course, Florida Senator Rick Scott has put himself in self-quarantine for the betterment of all people, including himself.
Corona affects the LGBT community today. Gay event cancellations continue all over the country. Here in South Florida, we broadcast from Wilton Manors, Fort Lauderdale, Florida. We joke the gayest place on planet Earth, and literally we prove that today because all three of our major gigantic pride events, including the largest one in the world in 2020, have announced postponement cancellation. That is Pride of the Americas here in Fort Lauderdale, Miami Beach Pride in April, and Palm Beach Pride in March. It was also announced today here in South Florida that Miami-Dade County had a declaration of emergency, which means all large gathering events in Dade County have been canceled. That includes theaters, performing arts centers, and many more in terms of anticipation of the social distancing rule that the CDC is recommending. For the LGBT community, of course, President Trump's announcement last night on the cessation of travel to Europe is devastating to the LGBT community because Europe is our #1 travel destination. And all today, that has been expanded to include all air travel bans. The EU came out very strongly today condemning the United States and President Trump on that ban. So those are bullet point highlights. There's dozens more, but for emphasis, coronavirus, today is the day. Yeah. It has officially come. No going back. What do y'all think?
You know, for whatever it's worth, I do want to officially state our government has not protected us, prepared us in any possible way. That said, there's still a lot of things that we can do here in this organization with people watching, and then for your friends and family on making sure that you're prepared and ready. Because this is scary, but it doesn't have to be as scary as some of these numbers are purporting, because we are bringing it to you forward. So yes, with each of these segments, we're going to tell you it sucks to have all of these events canceled, to have all of life change in this next year and probably the next few decades. But we're here to help that and make sure that it moves forward in a way that helps all people.
Yeah, what I find more frustrating here than anything, and I'll echo the sentiment as well, I'm very disappointed in the federal government right now. Not just Donald Trump, but collectively Democrats and Republicans in Congress and the United States Senate being able to move forward a financial stimulus package. They did in Congress today, but the Senate Republicans, but what else, blocked this financial measure that would have brought financial relief for countless individuals that are living on fixed incomes, paycheck to paycheck, that if they take off from work because they do feel ill, it's something that's going to impact them. It's a domino effect. And, you know, at the end of the day, with the special that we did yesterday and the information that we're going to continue to propel forward tonight, these precautions, the things that we're going to tell our viewers tonight, are absolutely key and necessary to prohibiting the further transmission and contraction of coronavirus.
Well, absolute bullet point. Both of your observations are bullet point. America, what we're going to attempt to do here tonight is to provide complex on many different topics, recommendations to you that you should be paying attention to in recommendations of how to combat the situation that you're going to experience now with coronavirus. Many things are going to be forced on you. The number one issue that we want to put in front of you is, I echo my anger with the federal government. We have been covering coronavirus since January 9th, almost instantaneously in the news from China. We have had 2 good solid months to prepare, and it has been wasted. And it has been wasted by our federal government. I feel sorry for mayors of municipalities, our mayor here in Fort Lauderdale. I feel sorry for our state governments, the access to testing, etc. We could have done so many things. The horse is out of the barn. Wildfire has begun. Now, even with all of that said, I echo what we're going to try to do tonight is to provide you simple, common sense information to be the antithesis of the Vice President's briefing of telling you absolutely nothing about nothing. So that's what we're going to try to accomplish tonight, to provide information, because information and accurate information overcomes fear, and overcoming fear overcomes panic. And that's what we will try to do tonight at Q News Tonight. So let's begin. Our first subject area that we want to talk about on the coronavirus crisis is about laundry. It may be something that you don't first consider, but what happens if coronavirus is present on your clothing, beyond your hands, or other items, and what do you do to launder it? So that's what we're going to discuss now in terms of recommendations.
So yes, a tisket, a tasket, keep that laundry in the basket. Like Taylor Swift says, shake it off, but don't. Don't shake your dirty laundry. It has the potential danger of spreading the virus through the air.
And that's right. Of course, this is the LGBTQ special, and we want to remind you to keep it sexy. Keep it hot and keep that water very, very warm. Make sure that it is as hot as possible while you're cleaning to disinfect what you are cleaning.
And our number 3 recommendation is disinfect your hampers. You can have coronavirus on your clothes, but generally initial studies are indicating it only survives between 5 minutes and 2 hours. So if it's on your clothes, it likely is in your hampers. So once you have taken all your clothes out, you need to disinfect that hamper. So those are recommendations that we have for laundry. Any concerns about, have you thought about it being on your clothing? Any concerns there?
Well, until we did the special, I actually did. And when I think of any kind of virus, like I said yesterday, viruses have the potential to live up to 6 months on hard surfaces. We even talked about this virus potentially living in soft, porous surfaces like rugs and carpeting. But I mean, to say that it could possibly be sitting there in your hamper, in your dirty laundry, it's something that's very concerning. So you have to really think outside the box to combat this disease.
Let's move into our next section that affects everyone that's listening to our voices, and that is what happens in business. Tomorrow you're going to go to work, and if you're an LGBT business owner, you run a business, and certainly there's high likelihood of you going to work. So here are recommendations for business owners in the LGBT community, and if you are going to work tomorrow and are concerned about coronavirus. So here are our recommendations.
So yes, recommendations for business owners, employers, and their employees. 1, sick employees should always stay at home, in particular those who have temperatures of 100.4 or higher. Should also, of course, notify your employer that you're going to stay home and stay sick.
And a number 2 recommendation is to understand your sick leave policy at where you work. Tomorrow you should go in and ask your manager or the owner or employer, what is the company's sick leave policy in terms of anticipation of what would happen if you did get sick. Ask in advance.
And employees out there, number 3, don't be afraid to ask to stay home from work.
Number 4, employers.
And meaning to work at home.
Sorry, yes, to work from home.
Exactly. And then on the opposite end of the spectrum from the employees, this next one, number 4, is for the employers. Do not require any kind of notation from your employees. They might have respiratory illness or anything else that is valid. Don't require more effort than is needed. Let's be careful for us all.
For you working tomorrow or an employer with employees, you're an LGBT employer. Number 5, ask for flexibility over family issues. Very likely it's not you that might contract coronavirus, it's a family member, and you might be put in a position where you're in self-isolation or you need to be at home. Tomorrow you should discuss the flexibility possibility of someone in your family or that you live with contracts coronavirus, and discuss that in advance. We're finding, by the way, that many employers are not addressing coronavirus issues yet, and that's why these recommendations are very valuable for you to start to push it before it becomes a crisis in your workplace environment.
Which is why this next recommendation is so critical, so crucial, so key. Number 6, employers, separate your sick employees. If someone is feeling sick, don't be afraid to send them home.
Right.
Number 7 is all about respiratory etiquette. Make sure that you emphasize having that respiratory etiquette and that everyone uses hand hygiene in all ways possible at all times.
When you consider your work environment, employers, make sure you poster up. Every policy that you want to implement in a coronavirus crisis that we're beginning to move into should be posted, and all of your customers and all of your employees can see it. If you're an employee going to work tomorrow, suggest that to your employer. Let's put up notices of exactly the policies and procedures that you would like everyone to follow as they come into your business or work in your business.
In addition to that, it's very important for not only employers but employees also to provide supplies like tissues and non-touch disposal receptacles as well.
Number 10, make sure that you are washing your hands at work and everywhere else. Make sure that if you are using hand sanitizer, it's at least 60%, but if you're washing your hands, use hot water and soap and wash it for 20 seconds. That means sing that Britney Spears chorus to your head, girl. You're going to make it fine.
Yeah, I love that. Britney Spears works for me, and I do it. You know, I'm counting every time I wash my hands now. I'm using numbers. I'm not singing a song, but I notice I'm doing much better at washing my hands.
I've been singing Oops, I Did It Again for years.
Right. Number 11 in that vein is your workplace should have alcohol-based hand rubs. Period. They should have alcohol-based hand rubs in your place of employment. If they don't, tomorrow ask where are they and when will they be here. It's very important.
And this is so crucial. I'm not just even doing this at home, but it's also important for employers to know that your office and your spaces should be cleaned daily, especially those workplace stations, countertops, and those doorknobs.
Yeah.
That's right. Speaking of doorknobs, number 13, get those disposable wipes. That's for every kind of commonly used surface. Doorknobs are one of them. Keyboards, remote controls, desks, keys, money, all of it. Clean that stuff.
The business should have it, but again, if you're an employee, go in tomorrow. If they don't have have them, ask where they are, and when they're going to arrive. Number 14, evaluate if you have to travel for work. That should be a caution. You probably, in the business, should suspend travel for a while and ask tomorrow what your policy is going to be in coronavirus and the emergency that is coming in terms of how this will affect the business's travel policy, especially in terms of you having to travel.
Yes, and further with that travel policy, get to know your company policy for travel outside of the United States of America right now. We know, of course, with the Trump administration, it might be ever-changing, but nevertheless, it's important to follow this disease as it continues to spread from region to region all across the country.
I'm expecting as early as probably Monday or Tuesday that they will implement an air ban where I can't fly from Fort Lauderdale to Miami. I'm sure that's coming next. Number 16.
That's right. You want to make sure that you're advising your employer or the employee, if you are the employer, of any kind of sick family member. This is all about communication. If you're interacting with somebody who may be contagious, then tell all those that are around you so that they can take appropriate precautions, and yourself as well.
Honesty, honesty, honesty. Such a key to minimizing spread. Number 17. To that point, inform all employees. Your employer should inform all employees of anybody that is being self-contained or has been confirmed at COVID-19. As share information openly, there should be no fear at all in doing that. And that is basically a summary of what you should do at work. We all are here at work. What do you think about our recommendations? What do you think?
I think that I am going to follow that right now very well, lovingly.
Would you like some?
Sure.
Absolutely.
Thank you.
I'll even rub it on the face like
From washing that man right out of my hair to washing that virus off of my hands.
That's exactly
Look at
right.
that.
And don't forget, by the way, you do it and also around your mouth and your nostrils.
Oh, yeah, they did say that.
Yeah,
I do
absolutely.
remember that
Safe.
now.
I think what's so interesting
I feel good.
about all of this is that we have an opportunity to not just come together as a nation in a way that we have not had the opportunity in the last couple of decades, but to really pay attention to ourselves and our social health that we have not in the past.
Well, it's interesting out of this because, not to make light of the situation at hand, but, we were talking about having these products, especially sanitation, that they're 70% alcohol-based. And, so I went through some drawers and I noticed that my old Bath & Body Works hand sanitizer was literally 10% alcohol, 90% glitter. Yeah. So it's very important to know what you're getting yourself into with the sanitizers and products that you use.
That sounds like a common gay problem.
It is a very common gay problem.
Glitter.
Glitter, right. All right, we move on to our next topic. Very important to us, a centric issue, gay nightlife. What's coming next with coronavirus for our gay events, our prides, and our bars? What happens to gay nightlife? So, Aaron, why don't you begin?
Yeah, so the industry is now responding, not just the service industry, but of course nightlife, those gay LGBT bars. Hospitality and nightlife establishments are regularly focused on staff hygiene, employee health, cleaning of surfaces, food and drink safety, and guest well-being in order to continuously comply with strict health guidelines and regulations. And businesses are currently redoubling this standard of best practices already to combat the effect to ensure safe public environments and healthy workplaces. But most of all, use your common sense, people. Monitor city announcements, especially for those highly populated metropolitan cities like Fort Lauderdale, for example, on developments, but don't overreact with unwarranted fear.
Mm-hmm. That being said, we know that at least for the time being, you're still going to go out to events, bars, and restaurants to some extent. And the CDC has advocated that local health officials are stating to postpone and cancel all of these events, but also that there has to be a level of standards used, reasonableness by every single person that's there, and responsibility by every single business that is in any kind of event or in operation. To
the gay community that is thinking about going to the nightclub tonight or this weekend, we advise you what Zurich is doing. Zurich is decided to try to manage their response in coronavirus by closing all nightclubs in the city of Zurich. 1.5 million people affected. All nightclubs have been temporarily closed, and they're trying to flatline that bell curve of coronavirus issues. And so that's an example of what is happening in some places in the world and could happen here in America if we see dramatic spikes. In fact, an example of that has already begun. In Scottsdale, Arizona, a bar has already had confirmed cases of COVID-19, and there was quite a significant reaction in Scottsdale. We've prepared this video. Watch this.
eBay, the company Riot Hospitality Group owns both Riot House, which is right here behind me, as well as El Jefe, which is right next door. In a statement on social media, the company says this employee was at both places overnight between Saturday and Sunday this past weekend. But the company also says that there is no risk to anyone at this time, and in fact, Riot House is already back open.
The bottom line in the recommendation of our events, our prides, our bars in the LGBT community is combining all of the recommendations that we gave last night, which is social isolation, which is why you're seeing prides being canceled all over the United States. A complete wipeout here in South Florida today. 3 gigantic prides canceled over standards of social isolation. We reported to you last night. You're keeping a distance of at least the 1 yard rule, 3 feet away, 3 to 6 feet, but 3 feet is the general standard. And the question then becomes, if you're going to go into a crowd, what is the size of the crowd? Many municipalities are going to continue to reduce the number of events that can go on with the number of people. Some cities 150, some cities 250, but it is changing rapidly. And it's all based on good hygiene, self-isolation if you are ill, and ensuring that you minimize risk. If you calmly take that approach, we are going to get this under control.
Yeah.
Other related issues with our events and our bars and our products.
I'm actually relatively proud of the LGBT community. There are so many times in the past that we have been the scapegoat as to why something is spreading, as to being the cause. Obviously, HIV is the first thing that comes to head. But we are doing a great job, at least as a global community. We're canceling the events where people gather. We are telling each other that we should not be going to clubs and having this kind of superfluous or gratuitous interactivity. We are having our parties that are in Austria and Germany where there are some kind of extreme behaviors canceled because we know what the value of this is and why human life is important. I think that we're some of the best community standards to be setting right now because we're actually showing people how you have to be interacting as interactions should be taking place.
Very interesting observation, Aaron. I'm curious, would you be nervous going into a parade or going into a bar?
No, actually I wouldn't, because I mean the things that we even talked about yesterday and the things that I continuously see being recommended by the CDC, the World Health Organization, Health and Human Services, this is a completely preventable disease. It's just you necessarily taking the precautions necessary to somewhat isolate yourself in public settings from other people, but also own your personal hygiene.
Yeah, absolutely. And it moves us on to our next segment that we want to talk about in coronavirus and dining out. The gay community, the LGBT community, we live in restaurants. And so we wanted to take a few moments to talk about dining out and what's important in terms of food safety.
So eateries and restaurant industry is really taking a hard look at this and taking extra necessary precautions to combat the transmission and contraction of the coronavirus. It's important to note that as of today, from what we know, that food does not transmit the coronavirus. However, in a restaurant setting, salt shakers, utensils, menus, for example, those are hard surfaces that could carry the coronavirus.
You know, it's interesting in the hard surfaces, McDonald's gave us a good example. Tell us about what's going on at McDonald's.
That's right. McDonald's is saying that hand sanitizer dispensers are available at the entrances, and they're, along with many other companies, trying to push forward everything that they possibly can. They don't want you to touch doors, kiosks, touch screens. In fact, in other parts of the world, they have all sorts of different procedures where you have to interact just in 5 steps removed. Everyone wants to make sure that business can happen and that we can continue to provide and move forward as a society.
America, we do report there is greater coronavirus risk at buffets. Different kinds of buffet restaurants. Sneeze guards are not sufficient, not only because of the sneeze guards not being sufficient, but also because of all of the related issues that go on in a buffet. So you should really be mindful and concerned in terms of participation during this coronavirus threat and buffets.
It kills me hearing that buffets could be at risk
Yeah,
in this
exactly
country
right.
and all over the world. But part of that in those sneeze guards is cross-contamination, which is absolutely so crucial here in this conversation that we have to have when one is dining out. What could possibly be cross-contaminated?
Right.
That's right. And we want to make sure that you know that delivery can be safer, and that's both for the patron and the person that's providing. The CDC has advised that if you're at high risk, maybe just get it delivered. It's an easier solution, and it keeps businesses afloat, so keep that in mind as an owner.
Well, dining out, what are your thoughts about safety, etc.?
Well, it's definitely something that I have thought about a lot. And, it's concerning because of the schedule that I keep and because of the schedule that my partner keeps. Unfortunately, we don't have a lot of time to cook food at home. So literally, I mean, this is our privilege, but we eat out almost every single night. And when we don't actually go to a restaurant, we go to Whole Foods. We get the prepared food, and they do have the sneeze guard there. So this is something that I'm thinking about a little bit more as we continue to go out, but I don't think that I will necessarily change those habits.
And for you, Napoleon, any concerns about eating out?
Well, you know that I'm very cheap, so I try not to as much as possible. Anyway, I always have great fears about somebody just coming in and sticking their finger in the Whole Foods display. But ultimately, what this comes down to is making sure that we're protecting ourselves and the people we care about, and that means simple little endeavors. So every moment of how we interact for the next few weeks, we have to be careful of what we're doing. Nope, not going to touch my face. Nope, not going to touch that. Be careful, and that includes how we're eating.
Yeah. And every time you touch something, tongs,
Madonna,
Madonna, you sanitize.
Sanitize.
Exactly. All right, let's continue to move up and continue our coronavirus conversation to something that we know you want to hear a lot about, and that's hookups. Queuing up the effects of coronavirus, what about casual sex? And we're going to have a discussion about what Tinder thinks and Grindr thinks. Can you go to a bathhouse, and what do you do about sex? Aaron, let's start with you.
Okay, so I know my mom's watching, so she's like, well, what the hell is Tinder? What is a Tinder? Is there a cream for that? But so what are social apps saying? Tinder, for example, is asking its users to continuously maintain social distance amid this coronavirus outbreak. Of course, but what else for the LGBTQ community? We have very popular apps, one of them being Grindr. Grindr is even flagging their users with a message asking them to do best practices in terms of washing their hands, using hand sanitizer as well.
Okay.
Moving forward, as far as the hookups go, because we know some of you will still have them, there is still a risk involved, so be aware of what that is. And that's primarily about respiratory secretions. Respiratory secretions are anything that comes from a mouth while you're coughing or sneezing, and that's something that a person that is infected can carry. So make sure that if you are involved with somebody that you're aware of all of that.
I want to draw a highlighter on this point. The number one thing that we have come away with so far on coronavirus is the infection spread comes from respiratory droplets in cough or sneeze. So that is the number one way infection is taking place, minimizing that, social distancing from that, mask of that, and if it can't be controlled, frequent hand washing and sanitizing is the way to defeat coronavirus, even in a sexual contact situation. Sex risk, next, what we don't know but we suspect, and this is according to the Cleveland Clinic. Cheek kissing, a no-no. Don't kiss someone's cheek. Recommendations, remember last night, no handshaking, no fist bumping, no hugging, oh, by the way, no touching. And that includes cheek kissing.
And then as far as kissing goes, make sure that with mouth-to-mouth exchange, it is a risk, so you don't want to be transmitting it in any possible way. Transmissions occur between 2 to 12 days, so the individual may not appear sick, and that saliva exchange can transmit the coronavirus. And that moves into oral sex as well, especially with the LGBT community. We know that that's important. And while there's no evidence that the virus can be transmitted through vaginal or semen fluids, you want to make sure that you're careful while you're having any, I know my words, any kind of oral sex as well, and make sure that if it's anal sex, that there is no evidence of the virus currently living that can be transmitted through feces, blood, or other transmissions. It cannot go through in any of those factors, so be careful with anal sex, but be aware of how it can actually be transmitted.
So, sex and best recommendations. No kissing, no cheek kissing, oral sex, anal sex are not transmitted in any fluids, blood, feces, any other way except respiratory droplets. That is how it's transmitted. So if you're going to participate in
Extracurricular activities.
yes, in a bathhouse, your grinder hookup, casual sexual experiences, remember you're evaluating those that might have flu-like symptoms, whether you're going to get physically close to them, etc. But remember, the number one issue is it is coming from respiratory droplets. So anything that you can do to minimize that is the best recommendation for sex. We want to tell you something that the Cleveland Clinic said. Dr. England of the Cleveland Clinic said, quote, "We think that the risk of transmission is greatest when people are symptomatic. If you're worried that a partner could be a carrier of coronavirus but is not showing signs, it's best to postpone any sex sessions until you know their health status for sure." That sounds like good recommendation to me, and then you evaluate what is the best choice. Now, sex, what do you think?
It took me my entire life to get over this Julia Roberts fanaticism. I was always about just have the fun, don't have to kiss them, it's okay. And now I'm finally starting to embrace people and try to be romantic and embrace who they are and kiss them and love them for who they are. And I'm told, no, just have sex, don't kiss them.
Yes.
Is that what you've heard over the last 5 minutes?
Yep, that's all I heard.
Okay.
So of course,
I'm a pretty woman.
Yeah, right. So just to, I'm a pretty woman. Okay, I'm a pretty woman. So you know, the doctor that had made that earlier statement about the Cleveland Clinic. So it is really important to actually postpone any kind of sex sessions. And for those viewers out there that know that I'm very political, I said postpone sex sessions, not Jeff sessions. But
or both, you know,
or both.
That's fine too.
Hey, Alabama, you listening? But you know, I mean, the reality here is, I go back to a 5th grade sex education class that I had taken. This is like chocolate and vanilla pudding. So you have chocolate pudding and you have vanilla pudding. Let's take some of that vanilla pudding and put it in the chocolate pudding. Try to get every drop of that vanilla pudding out of the chocolate pudding. You can't, because once you have mixed together, you are forever connected. So it's like being with, in terms of sex, it's like having sex. You have sex with one person. It's like having sex with every person that they ever had sex with
Fascinating
as well.
illustration. And by the way, I have to say to you, I'm so impressed that you were able to
Connect this to food.
Connect coronavirus, food, sex, and
Jeff
Sessions all in one joke.
It's a superpower.
It is a superpower.
It is. Thank you.
Exactly.
It's my blonde sense tingling.
All right. So, America, where else could you get this kind of advice on coronavirus in the LGBT community and Grindr?
Through pudding.
All right, through pudding, right. Let's continue up and talk about one of the great passions of the LGBT community, and that is gay travel. Have you looked at what's going on in travel? You can fly to Europe, well, you can't now, but you can fly to Peru for like $179. Coronavirus and gay travel. And we want to talk about what is going on in gay travel. Aaron, you start us out.
So we know that from last night with President Trump, there are a lot of travel restrictions, and then today there aren't as many travel restrictions. But regardless, it's important. Don't go off the Trump administration. Go off the Center for Disease Control and their travelers' health notices that will post these very the latest guidelines in regards to where people should and should not be traveling.
That's right.
That's right. And travel, gay travel, is going to get cheap. You want to consider what you have as options. Number 1, can you get a refund related to coronavirus? I know I could back a month ago. Number 2, are you going to be traveling to a high-risk area?
That's right. And considering gay travel, number 3, what precautions are you going to have to do to implement while you're traveling? And you balance those concerns and anxieties with the experience, the great experience that you have while you're traveling. Number 4, what will happen after you arrive on your cheap trip? The Italy example, for example, if you show up at a destination and many things are closed because of an outbreak or coronavirus issue, what will happen? And then number 5, does the cost of the cheap trip currently outweigh the risk of coronavirus and what you will
And
experience.
let's talk on that for a minute, because it's easy to interpret, especially for all of the trending things about millennials saying, oh my gosh, for $5 I can go around the world and bring back souvenirs. Well, the cost isn't just the amount of money that you're spending on it. The cost is the way that you have to interact with every person that you're around thereafter, or who you might infect. If you have anyone over the age of 50 or somebody that you care about that might be in some way more susceptible to this, it's great that you're 25 and you're going to be immune to this, probably, but you might impact somebody in your life forever, or many people. So you have to be aware of that or other things that could be the cost.
So important evaluations on whether you're going to travel. Our general recommendation is probably a good idea to suspend until we have a better feeling to overcome the anxiety and information which overcomes fear. Let's continue into our next area about something that's very important to the LGBT community and healthy gay people, and that's the supermarket, especially fresh produce. And so we talk about coronavirus and the supermarket. Aaron, let's begin there.
Well, thus far from what we know, there is actually no evidence that has been shown that coronavirus actually can be transmitted via food.
Yeah, and that's very important. Mary Nessel has come out, a doctor in nutrition at New York University, indicating there's no evidence that coronavirus is going to live in food.
Yes, and that is true. However, there are foods that people eat raw, primarily fruits and vegetables. So make sure with those, because they are handled in our country by people that just interact, can be cross-contaminated as they're moving through the environment, you wash them thoroughly. And it is advised that you actually cook them versus just eating them raw or in any way undercooked.
Yeah. And avoid prepared foods at grocery stores. Napoleon said, I love Whole Foods. Oh, my goodness, so do I. Frankly, that's a no-no for right now. You should be mainly concerned about the sneeze guards and the protection that gives you, and also the handles, the tongs, etc. It's just not a good time for prepared foods at grocery stores. It's probably a good time to avoid them for the near future. So that's what we can do on our foodstuffs. Boxed foods, prepared or rather non-perishable foods, etc. No issue at all. Any thoughts about our food sources?
We're talking about food, but we're also talking about some of the things we said yesterday. I want to recap. That means everything that your pet might need. That means any medications. That means anything that you might need in the next couple of weeks or months to just survive in an effective way. We saw some of that imaging. There are big groups of people that are going out to shop right now. Yes, be a part of that, but you don't have to put yourself in a position where you're going to be without. Be prepared.
Let's move on to another big area for the LGBT community, and that is also in healthy lifestyle, the gym. We call this coronavirus and the gym, and what are we going to do next? So Aaron, let's again begin with you.
Yes, Philip Tierno, who's a clinical professor at the Department of Pathology at New York University, has gone on to state there is a risk of coronavirus because of direct and indirect transmission. Very important. You can see the dangers imposed by a place like that on an ordinary basis. You're dealing with hundreds of people over a day. The risk of getting sick can actually increase with an outbreak like coronavirus.
So it's a yellow light that first, this doctor at New York University is saying there is greater risk in a gym. That's the first note there. Okay.
That's definitely true. However, we know that it's important to stay healthy as well, especially as you're preparing for this. So the most effective way that you can still continue to use the gym without infecting yourself is to wash your hands. And that's before you go, that's halfway through, and that's when you leave. Make sure you're scrubbing, and for the 20 seconds, sing that Britney Spears and have a good time while you're there so that you're being safe for yourself and for your neighbor.
Our third recommendation, which I'm very confident with, I've been to the gym with Napoleon and he's watched me do this. The responsibility of sanitizing machines isn't only on the gym staff, but tell your gym that you are keenly watching their sanitation procedures. Walk in tomorrow to the gym and say to the manager, this is keenly important to you in terms of the procedures and protocols that they use.
Take initiative, change the world.
That's right.
And part of doing this is also just best practices, being prepared when you're going to the gym, what you're doing while you're at the gym, and then after you leave the gym. So one, bring a cloth towel and a sanitizing spray bottle with you. Have that clean towel and that spray bottle of sanitizing liquid. And two, of course, spray wipe down all of the surfaces that you touch, especially the handles on all of those workout machines.
And of course, that means repeat that on every single machine you use. You have to clean every surface you use. And when you do that I found other people start to do the same thing, and you're creating an entire community where people are cleaning and taking care of each other.
Absolutely. So if you follow those procedures, even in a higher risk location, you start to minimize the risk because you're wiping down your machines. The gyms, either of you afraid to go to the gym?
Well, that was always true for Harry. So I don't think he ever lost that.
That was
fear.
a read. That was a
both of you.
pre-read, America.
Stop it, both of you. You know, it's funny. Someone asked me if I went to the gym the other day, and I said I do. It's spelled G-Y and the M, but the M is golden arches.
I've been a little bit nervous, honestly. I mean, it's still weird. People aren't even washing their hands the way that I would think that they would be. I watch people just go
But
in and
weren't
go
you
out.
into that like a week ago?
Yeah, a week ago I was. The world changed a lot in that week, Aaron. But the thing that I found that I've most been happy about is that I actually have been able to change procedures for myself and for other people. You changed my world when you showed me what I was supposed to be doing in the gym to make sure that I was safe, and I feel
The
better
cloth
for it.
towel,
Yeah,
exactly.
It's different.
And America, I really appreciate you saying that, Napoleon, because when Napoleon and I go to the gym, I followed the recommendation, which is a clean towel and a spray bottle. And I go in, and before I touch whatever machine I'm doing, handles, knobs, whatever it might be, screens, it's a spray down and it's a wipe down. I know for sure there is no coronavirus.
And it's different
present.
than just using the paper towels that are there.
Exactly.
It just gets it more effectively,
exactly right.
accurately.
America, we want to let you know, we hope that you're finding these recommendations valuable to you. And we are broadcasting tonight from our studio set in the middle of the World AIDS Museum and Education Center here in Wilton Manors in Fort Lauderdale, Florida. We always joke we're coming from the gayest place on planet Earth, and one of the reasons why we're bringing you this special is because we are in the gayest place on planet Earth, and everything that we're talking about hits us front and center just like it is coming to you. So we want to help prepare you. We want to move next into myths about coronavirus. And this is just going to be kind of bullet points, right to the point of each of these myths. All kinds of rumors. I read one today. It came from a friend of mine that works at NBC in New York, and he said, we are patting down this rumor that is rampant that coronavirus started because people in China were eating bats. Now, it's ridiculous, but there are so many myths, and we call this Mythbusters, this segment. Coronavirus Mythbusters or not fake news. So we are going to, do we have the Trump quote? Okay, well, first off, let me show you why there are so many myths. It started with the President of the United States, frankly. Watch this.
I think the 3.4% is really a false number. Now, this is just my hunch. Personally, I would say the number is way under 1%.
You know, this came as a surprise to all of us. It just happened. It shows what can happen in life.
We have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work.
The Obama administration made a decision on testing that turned out to be very detrimental. It's going to disappear. One day, it's like a miracle. It will disappear.
Well, you can see where coronavirus wildfire began in the United States. It's a miracle. It's just going to end, and you can go back to work, and everybody's going to get healthy.
Sounds like fake news.
Yeah, it sounds like a lot of fake news to me. All right, so myths, and we're going to myth bust here. Not so fake news, and we're going to run right through these of things that are being said on the internet, and we're going to confirm or debunk them right now.
So who are you going to call? Mythbusters. Cold weather and snow cannot kill the virus. There's actually no reason to believe that the cold can actually kill a virus.
That's right.
And on the same note, a hot bath cannot kill the virus either. A hot bath does not kill COVID-19. Your normal body temperature is 36 degrees. It's not going to be killed by a hot bath.
That's right. A common myth is that you have to be careful of touching any boxes of goods or the goods themselves that were made in China, because that's where coronavirus came from. Coronavirus is not live on the box or the product. It is completely safe. That is a myth.
And mosquito bites. So can mosquitoes transmit the coronavirus? We don't have any information, nor do we have any evidence that would suggest otherwise.
That's right. And that's number one. Remember, respiratory droplets, that is how coronavirus is spread.
Next, hand dryers do not kill the coronavirus. However, if that's your means of drying your hands after using soap and water for 20 seconds, then it is effective.
Ultraviolet lamps do not kill the coronavirus. They do nothing at all to limit the infection that you might be carrying on your hands. The solution is to wash your hands for 20 seconds or use a sterilizing agent.
Thermal scanners do not detect coronavirus. It's a little silly when you really think about it, because thermal scanners are effective in detecting one's fever if they've developed it, but perhaps not the coronavirus.
That's right. And while both alcohol and chlorine can be used to disinfect surfaces if the alcohol is over 60%, they cannot be just sprayed on your body to kill the virus within you. If you have already contracted the disease, do not just spray alcohol on your body to be better.
That's right. Your pets do not spread coronavirus. There has been no evidence that anything is spread by your dog licking you in the face related to coronavirus. However, question it, because they do spread bacteria like E. coli and Salmonella, but they do not spread the coronavirus.
And of course, this is a big one. Big one. Current related vaccines do not protect you from the coronavirus. So the influenza shot, other
pneumonia,
yes,
or even PrEP, which people have been saying.
Yes, all of those kind of vaccinations, there's no proof that those are actually effective as acting as a vaccination for coronavirus.
That's right. And saline nose wash does nothing for it either. Yes, it can be good for you, and you have to make sure that you're doing that correctly, but just washing your nose out is not going to be helpful for corona.
One of the most popular myth and fake news, garlic does not prevent coronavirus. Garlic is designed to keep vampires away from you, not the coronavirus.
And boys.
And that's why I can't get near you.
Okay.
So, of course, and all ages can contract the coronavirus. We've reported on this a lot. Knowing who is most susceptible to contracting this disease in particular, it's people over the age of 65, people with suppressed immune systems.
Mm-hmm. And a reminder that antibiotics are not effective against coronavirus. It's an antibiotic. It's only useful for bacteria, not a virus. A virus stays in your body forever.
That's right. And currently there are no medicines for coronavirus. There is nothing, if you get sick, that is prescribed. They're all management of symptoms. There is no medicine directly aimed at the coronavirus at this time.
And a recent claim that's been made, I've actually heard of this quite a bit today, is that the coronavirus is mutating into a more deadly strain. Well, all viruses accumulate mutations over time, and this virus that causes Covid19 is no different.
That's right.
So you don't have to be overly fearful. And then the next myth is, does coronavirus only kill older people? No. It can kill any type of person, especially if you have a predetermined condition. However, you want to make sure that you're utilizing all of these steps that we've given you today and yesterday to keep yourself from even infecting yourself in the first place.
There is a myth out there that we bust right now. Do I need to be exposed to the coronavirus for 10 minutes to be infected? No, that is not correct. You are providing a Donald Trump justification that they weren't with me long enough for me to be infected. That is completely fake news. The touch of the virus without washing your hands or using sanitizer, or the respiratory droplets being inhaled or on your face and then you push it to your mouth or your nose can cause corona infection. That is a myth otherwise.
And another very important claim is that a vaccine could be ready within a few months. Quite honestly, with the misinformation campaign that we're seeing from the Trump administration and with what's coming out of the CDC, World Health Organization, and other reliable resources of information, we just don't know. We just don't know when this vaccination is going to be ready.
Which is neither positive nor negative, just be ready. And then we want to queue up the effects of coronavirus, which is where we're asking, where is the accurate information that you can find in these next few days moving forward? We remind you to look at these next few sites. WHO.int, that's WHO.int, which is the World Health Organization, CDC.gov, which is the United States government, and then coronavirus.gov as well. Find all of your information there.
And America, LGBTQ America, we remind you, if we're going to get this under control, we must continue to listen to the White House, but not be guided by the guidance that they are provided, because frequently there is massive amounts of information that are coming out of them. There is almost a competency issue that is being raised by city governments, mayors, county governments, state governments, and even those in Washington. So we must be very careful of where we're getting our correct information. Napoleon's recommendation from World Health Organization, the CDC, and then coronavirus.gov. That leads us to our final topic that we want to discuss of queuing up the effects of coronavirus and how the LGBTQ community is infected. The most important single question of all, how long is this going to last? Frankly, you're going to be surprised. The flu virus that we started the top of Q News tonight and showing you the morbidity and mortality rates has been present in the United States and the world for more than 100 years. I'll stop. Coronavirus is a new version of that flu and therefore will likely be present for your entire lifetime. I'll stop. What will happen is a management cure, and life then will return to normal. It likely will get better as it gets warmer. It likely will get better when we finally have good testing and the number of tests that we need. It likely will get better as we continue to speed and spend the money in our organization of information from Washington and also our commitment to manage the worst portions of the coronavirus, a flu. But until that time, we're going to live in greater and greater panic. That is what you watched today at the New York Stock Exchange and yesterday. The cancellation of events and all of the events and activities that you're seeing on the news and around you in your neighborhood is a result of misinformation that's been going on for the last 67 days. The best way to get this under control is to not panic and take good information and process it in. One of the most important things is we have been through events like this before. 9/11, the economic collapse, and specifically for the LGBT community, we went through the 80s and 90s, and we know what catastrophe panic is all about. It was called AIDS. We survived that. We will survive this, but we will survive it with good information. And we hope in part 2 and last night in part 1, we've provided that good information. Any final thoughts on coronavirus and the infection of the LGBT community?
Yeah, it's interesting that you make that comparison with coronavirus and HIV/AIDS because I've thought about that nonstop. I was born in 1991, so I'm fortunate now as an HIV positive person that I can take medicine every day and that this is a chronic managed illness and it's no longer terminal. But at one point, like you suggested, in the 80s and the very early 90s, that was not the case. And I thought to myself, wow, I'm looking at the way the media is talking about this and I'm wondering, are they or aren't they blowing this out of proportion? It's kind of turning into not only panic, but hysteria, if you will. And I thought to myself, wow, is this the way that the AIDS epidemic was covered? Something to think about.
I understand that philosophy, especially with the idea of you can't touch your friends. You can feel scared, terrified even, and not have a hug, not be able to get next to people. That's something that's hitting me in a very visceral way for the first time now. The one thing that I am excited about, and excited is an odd term to use in this context, obviously, but we have a lot of power in this. We have control over our immune systems in terms of just keeping healthy. One of the best things we can do now is just to stay calm, like you said, is to meditate and to make sure whatever your needs are, that we control how we overreact or react correctly. And that's the best thing we can do to control our immune systems and stay safe for ourselves and everyone else. So that's what I'm going to do.
On behalf of Aaron, Dar, and Napoleon Plays, I'm anchor Al Ferguson. I challenge the LGBT community. We haven't done a very good job with this yet in America, but let's lead the country in our information and our commitment to pat down the expansion and the spread of coronavirus. We can do that. It is very manageable. There is no need for you to panic because information eliminates fear, which eliminates panic. We hope this has been beneficial, and we hope you'll share it with your friends because we think it can be beneficial for all of us. That is today's news for the LGBT community on the world's first daily gay evening news show. I cannot tell you how difficult this was for everybody connected with Q News tonight. There has never been a program like tonight and last night ever in history. We're all very proud of it. Remember, if it's important to the LGBT community, it's important to Q News tonight. We are literally out of the closet and into the headlines. And this is Q News Tonight. Thank you, and we'll see you at 7 p.m.